Hi, I'm Hans Moore and welcome to my part 2 video of hair transplantation. And what I want to talk to you about in this video is actually the consultation process of talking to the doctor and their assistants, and then how you prepare for your pre-op. The first thing I want to tell you again is the doctor that performed the surgery on me. His name is Jerry E Cooley, MD, and he's certified with the American Board of Dermatology. And he actually is one of the top hair transplant doctors on the East Coast. But the first thing you do, you want to research your doctor to make sure they're board certified with dermatology or board certified with plastic surgery. To make sure you're getting a really good trained doctor, and that's very important. When you go in to have your consultation, of course, I lived 3 hours away. I live in Virginia, but I went to Charlotte, North Carolina to see the doctor. And you'll sit down for a consultation with their assistant, and the assistant will go over with you of certain things that you'll need to know about the surgery, and then we'll tell you about some of the medications that you can use to help stop some of your hair that's thinning or receding or balding. And some of the products they talked about was using Propecia or Rogaine on your hair, and they actually write your prescription for that. You'll end up talking to the doctor's assistant for up to an hour to address all your needs and your target goal on either your hair thinning or your receding or balding. And then after the consultation, the doctor will come in and the doctor will talk to you up to about 30 minutes, so you can be prepared for an hour and a half of a consultation. And you'll also look at a book of other people who have had some of their work done that the doctor's performed on, and he can show you how many units of graft hair that will be transplanted to your hair. You can do up to 1,000, 2,000, 3,000, and so up. I opt to go for 1,000 graft units, which is called follicular unit micrografting. And this is where Dr. Cooley removes a strip of skin from the back of your head, and the strip of skin has all the hair follicles in it. And then he sends it to the lab, and he'll have 7 assistants cutting up the hair follicles. And each hair follicle consists of like 3 hairs or 2 hairs, so it's a lengthy process. The operation is actually going to be an all-day operation, so be prepared to go in at 7 o'clock in the morning and possibly getting out at 5 or 6 in the evening, depending on your target goal and how many hair follicles that you're going to have transplanted. So after I did my consultation, I waited about 3 months to clear my schedule and to do a little research to make sure this is what I wanted to do. So now I want to talk about actually preparing. So I went through with the surgery, and that's why I got the hat on, and I'll show you in part 3 of what my surgery looks like. I'm actually 4 hours now post-operative surgery, and I'll talk about the surgery process in part 3. But some of the things that the doctor is going to have you prepare to do before you come for your surgery, he wants you to massage the back of your scalp a lot and kind of stretch the skin. So, you might want to do that 15 minutes every day for a month or whatever. And that's what I did. Another thing is, when you go in for your surgery, you want to wear a button-up shirt, something that you don't have to pull over your head. The doctor's going to write you, he's going to pre-write you prescriptions, and you'll already have them filled before you see your doctor. And they'll give you something for anxiety, which you would take right before surgery. They're going to give you something for pain. I opted for Demerol because Demerol sits well on my stomach. And also it's called a Hibby cleanse, and this is only a $6 cleanse you can get at the pharmacy, and you don't need a prescription for it, but it's very, very strong to kill any germs. And the doctor had me wash my entire body and scrub my hair and face very well with this, and so I actually scrubbed my hair 3 times before my surgery. If you live out of town, the doctor will help you find a close hotel for you, and if you opt for so many units of hair, I think up to 1,000 to 2,000, sometimes I think depending if you go with 2,000 grafts, they'll pay for your hotel. And let me see what I got here. I've got a lot of notes, so I'm really just going to kind of read over what I went through to prepare for my pre-op. A week before you decide to have your surgery, you want to go off anything that's blood thinning, vitamin E, aspirin, ginkgo biloba, anything that thins your blood. And the doctors during the consultation and their assistants will give you a list of things, how to prepare for your surgery. And so then you want to go ahead and have your prescriptions already filled when you go to visit the doctor. And make sure you have your hotel. You want to make sure you have the directions from your hotel to the doctor's office, and you want to print that out on MapQuest or use a GPS. I printed out the directions from my hotel and to the doctor to make sure that I can get there on time without a lot of friction in case something happens and you get lost. So I'm not really sure what all to cover. It was very, very basic and easy to prepare for the surgery, and you definitely want to have someone drive you. You're going to need a driver to pick you up, take you to the doctor. Be prepared to stay in the doctor's office all day long, and then your driver will come back and pick you up. I can't really think of anything else of that I've done to prepare for the surgery. Of course, you're going to pay 2 weeks before your surgery, and so that's what I did. Let's see. And again, you just want to massage your scalp. You want to squeeze your scalp for up to if you're going to have a month to do that, you just want to do it every day, and that helps stretch the skin where they're going to remove a donor strip of skin, and that's what I opt for. You're going to have some papers that need to be pre-signed, and that will, during your consultation, they'll give you all that, and you'll take that home. You want to have all that ready for when you go into the doctor's office. And a couple hours before your surgery, you're going to want to scrub your entire body with Hibby cleanse, and that's what I did a couple hours right before my surgery. What else? If you have any questions, just leave me a comment. This is just a video kind of letting you know how to prepare for your pre-op. And then part 3 video, I'm going to actually talk about my actual procedure. So thanks for watching, and make sure you watch part 3. And again, the doctor that performed this surgery is Jerry E Cooley, MD, and again, he is Certified American Board of Dermatology. And thanks for watching, and don't forget to watch part 3 as I document more and more of my post-operative surgery. Thanks for watching. I'm Hans Moore.